Thank you very much, Senator Hatch.
Well, thank you, Mr. Chairman. Secretary Sebelius, we're glad to have you here and pleased that you're with us. Now, regarding the contraceptive mandate, I'm going to ask you questions that I think require only a yes or no, and we'll get through this more quickly, and hopefully I won't have to do it in subsequent rounds. You bet. Regarding the contraceptive mandate that has raised such significant religious freedom concerns, I want to make crystal clear what mandate is actually enforced today. Now, those religious freedom concerns have been directed at the amendments to the interim final rule issued last August. Last Friday, you finalized those rules, as I understand it. I have that final rule really right here. And it states that you finalized those very same controversial proposed regulations, quote, without change, unquote. Is that correct?
We finalized the IFR with an additional delay period for those religious employers who find objection to offering contraception, and they will have a year delay in implementation, so we can work out a strategy where they can abide by their religious freedom, and the women employed in those institutions will have contraception.
It's still the same directive, but subject to having a year, hopefully, where you can negotiate the changes that might need to be made. Is that fair?
The waiver language is as it appeared in the original rule in August, with the exception that religious employers will not purchase, will not provide, and will not offer, if they object, contraceptives directly to their employees. But the employees in those religiously based facilities will have access to that care with no additional copays or no co-insurance.
I have a copy of it here. It says these regulations finalize without change interim final regulations authorizing the exemption of group health plans and group health insurance coverage sponsored by certain religious employers from having to cover certain preventive health services under provisions of the Patient Prevention and Affordable Care Act. And then also it states in here, in other words, we're currently operating under the same language that was objected to by some in the religious community. It also says the departments have determined that it is appropriate to finalize without change these amended interim final regulations authorizing the exemption of group health plans and health insurance coverage, et cetera.
Mr. Chairman,
yes.
Sorry, Senator Hatch, we announced that we will be promulgating an additional rule dealing with the religious employers who currently do not offer contraceptive coverage because of religious beliefs, and that rule will be in place and effective by August of 2013 when the IFR would apply across the board.
Okay, in his statement on Friday addressing the supposed compromise on this mandate, President Obama said, quote, "From the very beginning of this process, I spoke directly to various Catholic officials," unquote. Now, prior to Friday, February 10th, did you consult with any individual Catholic bishop or the U.S. Conference of Catholic Bishops about this so-called compromise?
I did not speak to the Catholic bishops.
Okay, that's all I want to know. To your knowledge, prior to Friday, February 10th, did anyone in the administration consult with any individual Catholic bishop or the USCCB about that so-called compromise, to your knowledge?
I know that the President has spoken to the bishops on several occasions, yes.
Was it about that so-called compromise? You don't know?
I really don't know.
Are you aware of any consultation prior to Friday, February 10th by anyone in the administration, the President's reelection campaign, or the Democratic National Committee with any person affiliated with Planned Parenthood of America, NABRAL, or the ACLU about the so-called compromise?
Again, Senator, I know numerous conversations were had with religious leaders, with employers, with insurers, with stakeholders. With these groups as well? Pardon me?
With these groups as well?
I assume some of those groups were talked to. I really have no idea when you ask if anybody in the administration talked to anyone.
Okay. I wrote you last July that your proposed contraceptive mandate would be, quote, an affront to the natural rights to life, religious liberty, and personal conscience, unquote. I know for the record that your response to my letter completely ignored this issue. Last October, 27 senators joined me in writing you again asking for any analysis requested or obtained by HHS regarding these religious liberty issues. The response from your department completely ignored our request. There were 27 of us who asked for it. The President's Chief of Staff and Press Secretary have since claimed that this mandate is consistent with the First Amendment, and the final rule you issued last Friday states that it is consistent with the First Amendment and the Religious Freedom Restoration Act, which is the bill that I brought through the Congress. Let me just ask you again, did HHS conduct or request any analysis of the constitutional or statutory religious freedom or the statutory religious freedom issues?
Senator, I think
If you know.
what you heard was the President talk about two important principles: the availability of preventive
No, my
health
question
services
was,
to women and
it's a-
religious
My question
freedom.
is a simple question. Did you or anybody at HHS conduct or request any analysis of the constitutional or statutory religious freedom issues? That's a simple question.
Well, we certainly had our legal department look at a whole host of legal issues.
Did you ask
and
the Justice Department?
I did not, no, sir.
Okay, that's all I want to get. Well, my time is up.